Each year, heart disease kills more people in the U.S. than all types of cancer combined. Most of these deaths result from heart attacks in people with coronary artery disease. When it comes to heart health, there seems to be a lot of misinformation out there. So Dr. Nina Asrani, a cardiologist who is board certified in cardiovascular diseases, joins us to separate myths from truth about cardiac health. Good morning, doctor.
Good morning.
Nice to see you this morning. Let's get to the first myth. Heart disease runs in my family, so there's nothing I can do to prevent it.
So it's absolutely true that people with a family history of heart disease are at higher risk, but there are definitely still steps that you can take to dramatically reduce your risk. It's important to know your numbers for heart health, and that includes knowing your cholesterol, your blood pressure, and your blood sugar to know if you have diabetes. If those numbers are out of range, you want to work with your doctor on diet and exercise and on medications if needed. If you're a smoker, trying to quit is one of the best things that you can do. And it's also important to be active and to eat well. So genetics do play a role in developing coronary artery disease, but the American Heart Association estimates that 80% of cardiovascular disease, including heart disease and stroke, it's preventable. That's 4 out of every 5. So it's all about these basic risk factors, following a heart-healthy lifestyle, and taking medication if prescribed to control those risk factors.
Okay, myth number 2, you have to do hours of vigorous exercise every day to gain cardiac benefits.
So the recommendation is just for 30 minutes of moderate aerobic activity every day. And that can even be divided into smaller sessions if needed, just a few 10 to 15-minute blocks. Sometimes what happens is we set the bar so high that we feel like it isn't even worth trying. And that is absolutely what we don't want. So some exercise is better than no exercise. And your heart will benefit from any activity that you can do. The more you can do, the more you will benefit. And it can be whatever kind of activity works for you.
Okay, myth number 3, some superfoods will prevent heart disease.
So unfortunately, no certain food is going to prevent heart disease, although certain diets can. So foods like blueberries, pomegranates, walnuts, fatty fish, all of those things are beneficial for the heart, but unfortunately, there's no single one that's just going to prevent heart disease. But that being said, we should not underestimate the importance of an overall healthy diet. It's easy to get caught up in the details, but most healthy diets are going to have a lot in common. Things like whole grains, legumes, fish, lots of fruits and vegetables, and those healthy monounsaturated fats like olive oil, and wanting to avoid processed food. So a diet like that can absolutely help lower the risk of heart disease.
Okay, myth number 4, you can lower a very high LDL cholesterol level through diet alone.
Unfortunately, a large part of cholesterol is genetic. And so for those people, diet alone may not be enough. If your LDL level is very high, it's likely that you will need a statin or other cholesterol lowering medication to bring it down. Diet is still important, but sometimes medications are just needed.
Okay, finally, myth number 5, meditation is not helpful unless I devote hours per day to the practice.
So meditation is actually a helpful thing to do. It can do more than just relax the mind. There's some evidence that it can promote heart health, reduce overall cardiovascular risk, may lower blood pressure, reduce stress levels, and has been linked to healthier arteries and improved blood flow. That being said, there needs to be more research done on it, but it's something that anyone can do, and it isn't going to hurt to try. But again, whatever little bit that you may be able to do and incorporate into your life, it could help.
Okay, and myth number 6, I might have been told I had a heart attack, but I might not have actually had one.
So this is a strange one to most patients until that somebody tells them that they've had a heart attack and they think, but I didn't think I had one. And that's because there are a lot of different ways that we use to diagnose heart attacks. Sometimes it's based on blood work that people have done. Sometimes it's based on just the findings on an EKG or electrocardiogram, that paper tracing of the heart. And so whenever someone tells you that you may have had heart trouble, it's really important at that point to see a heart specialist or cardiologist to get it figured out to determine what really is going on.
All right. Thank you, Dr. Asrani. Good information, really important for all of us. Thank you very much. Stay safe and healthy.
Thank you.
Call 866-298-8521 for more information or go to thpg.org/hearttruths.